coronavirus in Connecticut. When it gets here, will the state be ready? Also, what about the vaccine debate? Should lawmakers get rid of religious exemptions? We'll ask State Senator Bob Duff and State Representative Bill Petit. Plus, expanding casino gambling. Sports betting? The head of the Mashantucket Pequots, Rodney Butler, is with us. And the race for the fifth, why former prosecutor David X. Sullivan says he is the best Republican to take on Congresswoman Jahana Hayes. It's all straight ahead on Face the State this Sunday, March 1st, 2020.
From Eyewitness News, Connecticut's most watched local political program, this is Face the State.
Good morning, everyone. I'm Dennis House. We begin with two health topics being discussed at the state capitol this week. First, the cloud of coronavirus is hanging over Connecticut this Sunday. And then there's the issue of whether the state should remove the religious exemptions for vaccines. With us today to talk about this, State Senator Bob Duff. He's a Democrat, and State Representative William Petit, a Republican, and also a doctor. And Dr. Petit, I will begin with you because I just want to ask, how fearful should we be of coronavirus should it come here to Connecticut?
I think as fearful as we are of the flu. I think people should take typical flu precautions, make sure they wash their hands appropriately, cough into their elbow, and not go into work or school if they are ill, avoid contact with people that are ill. The governor did a great press conference yesterday. The DPH and the state are very well prepared, and people can go to ct.gov and find plenty of information about coronavirus.
Senator Duff, do you believe the state is prepared, and how so?
Yeah, I do. I think the state is prepared. I'm glad the governor had a press conference yesterday. I think the issue really is in mixed messages. We heard this week from the White House, you had Larry Kudlow, who's the economic advisor, who said it's fully contained. We don't expect any more in the United States. And the CDC had a press conference, said the exact opposite of that yesterday. So I think it's important that we continue to message this out correctly so that people don't panic, that take the appropriate precautions, like Dr. Petit said, and that we do the things we do to keep ourselves healthy.
Do you think that people are starting to panic a little bit because they don't know much about coronavirus? You say it's similar to the flu, but yet people are dying from it. People die from the flu also, though.
Yeah, we'll have over 30,000 deaths from the flu this year, and I think there's been 2,200 or so deaths from coronavirus, I think mainly in China. So I think people should have healthy respect for it and take the appropriate precautions.
What are people doing at the Capitol about it? Any specific things you've witnessed in terms of offices getting ready for this or anything?
Not yet, but I think that it's all on our minds right now. We're all going to be engaging with our local town officials as well, ensuring that our communities in our municipalities are prepared as well. I think they're having conversations with the Department of Public Health, but this is for a broader and larger effort about ensuring that we keep the people of the state of Connecticut healthy and that we do everything we can to provide good information and make sure that they are taking the appropriate precautions.
Let's shift gears and talk about the vaccine exemption bill, and I'll begin with you, Senator Duff, on this. Were you surprised at the turnout of the people who came out to talk about this? That hearing went on, what, 22 hours?
Yeah, it was a long time. I'm not surprised about that because people who feel the way they do about not providing vaccinations for their children are a very loud crowd. I think they're a very vocal minority of the people who are in the state of Connecticut. Not all of them actually came from Connecticut. The person arrested was actually from New York. So I think that they do bring people in from lots of other places, but they're very passionate about how they feel on it. But I think that the vast majority of people in the state of Connecticut who vaccinate their children were doing their normal things during the day and going to work and raising their kids.
What do you think should be done here? What, in your judgment, how do you feel about this bill?
We need to make sure only people who should not have vaccinations are the ones who should not have it because of the fact that they have medical exemptions. We should take away the non-medical exemptions from our law and ensure that kids go to school are healthy and that we ensure the health because of the fact that we're seeing these vaccination rates come down.
Representative Petit, where do you stand on this?
I believe in vaccinations. My 6-year-old is fully vaccinated. I believe they are effective but have risks, as the opposition has noted. I believe our best weapon in this fight is education. You know, I would lay it out this way. I think there's 80–90% of people that trust their physicians and believe in vaccinations. I think there's 5% or less of people that are never going to be vaccinated no matter how much we educate and what we say because they just don't trust or believe the science. And I think there's a small group in between of 5, 10, 15% of people who are maybe on the fence. And I think those are the people we have to focus on. I think those are the people that we can focus our efforts on to try to keep our vaccination rates where they are.
So in your judgment, should the exemption stay in place?
I think we should use a different approach. We've been in contact with folks from the Yale Global Health Institute, and it seems that education is very effective. So I think we need to bring people in, educate them about the personal risks, about the community risk, what the options are, and proceed in that fashion.
Those who support this bill to get rid of the exemptions really face some confrontations by some of the people at the Capitol the other day at the Legislative Office building. What do you say to someone who comes up to you and says, you know, Senator, I want to make this decision for my child, not the government?
Well, I understand they're saying that. However, their decision impacts way more than just their own child. We're seeing herd immunity continue to go down in the state. We've seen it less in kindergarten since 2013. I think 450% less as a percentage. Their decision impacts everybody else. Our job as legislators is to really is to make sure that the health and safety and well-being of our citizens across the state of Connecticut is intact. Here we are talking about coronavirus, we're talking about flu deaths, we're talking about all these other things, and yet we're having a debate on whether or not people should be vaccinated. Of course people should be vaccinated. The science is very clear on that. If somebody has an autoimmune issue, then they should have that conversation with their doctor, and that is perfectly appropriate for them to do. But for somebody to say that they have a religious reason why they should not have a vaccination shot because they chose not to, puts not only themselves at risk, but it also puts other school children at risk as well. And so that's why it is very important for us to be proactive on this issue and to make sure that kids are vaccinated. The science is clear, the science is settled on this, and we should not be having a debate based on debunked information that has been out there. You
went to medical school, Representative Petit. Do you believe the science is clear?
I believe the science is very good. Vaccines are not perfect. Many of the vaccines, when you get the vaccine, 90 or 95% of people will have an immune response, so not everybody does, and some people have adverse effects. So yeah, I believe in them. But it raises a number of issues. If we're going to hold the kids to that standard, what about the teachers? What about the paraprofessionals? What about the cafeteria workers? What about the janitors? If we want to have a rate that's above 95% for the kids, do we have to consider other people in the school as well?
What do you think about that, Senator Duff? Should
well, I think that
these
ends
workers
up,
who are around children be vaccinated?
I think if you look at the history, most of them, if not all of them, are vaccinated. So it's never been an issue until just a few years ago. I think that's a straw man.
How do we know that, though? When they're hired, are they asked if they've been vaccinated and all that?
That I'm not sure. That may be a decision based on municipalities and how they fill out their applications. That I don't know. But I do know this, is that we are seeing fewer children in kindergarten and 7th grade who are being vaccinated. The herd immunity is being put at risk at this point. We're seeing measles cases in Connecticut. We've had a few of those already. We don't want to be back to the days where we see kids who have polio. So let's stick with what we have right now rather than going to straw man arguments on everybody else. What we need to do is we need to ensure that the kids who go to school are vaccinated and they don't put other kids at risk because of the fact that they potentially could be carrying a disease.
I want to ask you briefly about marijuana legalization. It's going to come up this year. As a doctor, would you support legalizing marijuana in Connecticut?
At this point, I cannot. I think the bulk of medical evidence is against in terms of its impact on people under the age of 25 in terms of cognitive function, executive function, memory, IQ. There's issues for people in the population that are susceptible to disorders with psychosis. Public safety still has issues in terms of interpreting how to do DWI and the like. So I think there's a number of issues that cause consternation for the state government and the public in general.
Senator Duff, would you support legalizing?
We have a bill out there for legalizing cannabis. We have to control our own destiny. You have Massachusetts that is legalizing, New York may legalize, Rhode Island may legalize. So it's not like Connecticut's this big state where people can't drive out of it to get to what they want. So people are taking trips to Massachusetts right now. So we need to control our own policy because of the fact that we need to look at what those policies are, as Dr. Petit said, and how we are addressing this for our youth, how we're addressing this in workplace standards, in other ways. We already have a black market right now for marijuana that is hurting our children with fentanyl, THCs, other types of drugs that are in there. So we can regulate it, we can tax it, we can do it in a better way than what's on the black market right now, and the fact that if it's coming in from other states, we have to deal with it.
Senator Bob Duff, Representative Bill Petit, we thank you both for being in the program today.
Thank you.
Have a good Sunday. Next, will casino gambling be expanded in our state? What about sports betting? And a reminder, you can watch past editions of Face the State right now on our YouTube channel or our WFSB app.